Hey guys, this is Dr. Today we look at the fatty acid oxidation. Fatty acid oxidation, and we'll be focusing on the types. So the types as well as the presence of the location and also the properties. So we start off with the beta oxidation. So this beta oxidation, the location is present in the mitochondria. So it is present in the mitochondria. And what are the properties? The properties is it is a catabolic process. It is a catabolic process, and by which two carbons are cleaved from the fatty acids. So two carbons, they are cleaved. So two carbons are cleaved from the fatty acid molecule, and it is released as acetylcholine. So it is released as the acetylcholine, and it starts from the carbamyl end. So it's starting from the carboxyl end. So other thing to note is that the chain is broken between. So it is broken, and this takes between the alpha 2 and beta 3 and the beta 3 carbon. So there is one round of beta oxidation it yields to. So one round of the beta oxidation it yields to 1 FADH2 and 1 NADH and also 1 acetylcholine CoA. So next we move on to the alpha oxidation. So in terms of alpha oxidation, there is presence of the peroxisome. So this is where it takes place. So the alpha oxidation takes place in the peroxisomes. And what are the properties? The properties is this alpha oxidation, there is a presence of the 3-methyl group. So 3-methyl group. So this 3-methyl group contains the presence of the phytanic acid. So this presence of the phytanic acid, and this prevents the degradation by oxidation. So this prevents the degradation. So it prevents degradation by beta oxidation. Next, the chain is broken between the terminal. This chain is broken between the terminal carboxyl group. So the chain is broken, and this will be between the terminal carboxyl group. So it's between the terminal carboxyl group and also the alpha 2. The alpha 2 carbon, removing that. So by removing that carbon as CO2. So you remove the carbon as the CO2. The remaining chain is activated. The remaining chain, if you see, this is activated with the CO2. So this is activated. This is with the CO2, and then it undergoes the beta oxidation. So it is not an energy yielding process. So this is not an energy yielding process. So what are the associated diseases with the peroxisomes? So here in alpha oxidation, the associated diseases, it includes the classic Refsum's disease. So the classic Refsum's disease. Next, it also includes the defective enzyme. It includes a defective enzyme. Defective enzyme, that is a phytonyl CoA hydroxylase. Phytonyl CoA hydroxylase. Next is, what are the clinical features include? The clinical features, if you see, it includes the ichthyosis. There is ichthyosis. Next, there is retinitis pigmentosa, as well as there is presence of decreased vision. Next, there is peripheral neuropathy, as well as presence of the ataxia. Next, we move on to the other type of oxidation, that is the omega oxidation. So in terms of the omega oxidation, what is the organ involved? It will be the endoplasmic. It is nothing but the endoplasmic reticulum. So under the endoplasmic reticulum, what are the properties? So endoplasmic reticulum, it has properties such as there is an alternative pathway. There is a alternative. It's an alternative pathway, and this is to the beta oxidation. So alternative pathway to the beta oxidation. It occurs in the microsomes. Next is, it involves the oxidation. It involves oxidation, and this is of the carbon, that is a terminal methyl group. So there is a terminal methyl group, and it results in the dicarboxylic acid. So this results in the dicarboxylic acid. So it is not an energy yielding process. So this is not an energy yielding process. Next, we move on to the paroxysmal beta oxidation. There is a paroxysmal beta oxidation. So here the organelle which is involved is a peroxisome. And what are the other features? The feature is that there is a very long fatty acid. There is a very long chain fatty acids, and they undergo a preliminary beta oxidation. They have a preliminary beta oxidation, and this takes place in the peroxisomes. And this is up to the octanoyl CoA. So the shortened fatty acids, they undergo the further beta oxidation. So the shortened fatty acids, they undergo the beta oxidation, and this is in the mitochondria. So again, this is not an energy yielding process. So it is not an energy yielding process. So which is not an energy yielding process is the paroxysmal beta oxidation. There is omega oxidation as well as the presence of the alpha oxidation. Next, let's look at some diseases which are associated with the paroxysmal beta oxidation. So diseases, it includes, there is presence of the Zellweger syndrome. So there is presence of the Zellweger. What is Zellweger? Zellweger is nothing but the cerebrohepatorenal. So the cerebrohepatorenal syndrome. Next, there is also presence of a rare inherited absence. There is a rare inherited absence, and this is of the peroxisomes. The absence of the peroxisomes. This is in case of all the tissues. So they accumulate the C26. So the C26 to C38. So they accumulate the polyenolic acids, C26 to C38, polyenoic acids, and this is in the brain tissue. This is in the brain tissue, and it also exhibits a generalized loss. So it also exhibits a generalized loss. So generalized loss of the paroxysmal functions. Paroxysmal functions, and this disease causes severe neurological symptoms. Causes severe neurological symptoms, and most patients, they die in the first year of life. So in the first year they die.